In this procedure, you will learn how to instruct a patient in the proper collection of stool for an ova and parasite microscopic examination. Greet the patient and identify yourself.
Hello, Jeff. How you doing?
Good.
Good. My name is Tori. I'm Dr. Smith's medical assistant.
Verify the patient's identity with his full name and ask the patient to spell his last name. Then ask for his date of birth.
If you can please give me your full name
Jeff Leanhouse,
and your date of birth.
11.
Explain the procedure to be performed in a manner the patient can understand.
All right. Dr. Smith would like for you to give us a stool sample. I'm going to go over everything with you, okay?
Answer any general questions the patient may have about the collection procedures before you give detailed instructions.
Do you have any questions before I get started?
Instruct the patient not to take any antacids, laxatives, or stool softeners before collecting the specimen.
No, there are no food restrictions. We just want you to stay away from laxatives, antacids, or any stool softeners.
Tell the patient how to collect the specimen.
I'm going to give you a hat. This is what you'll collect the stool sample in. You're going to sit this on the toilet.
The patient must defecate into the container provided. Stool cannot be retrieved from the toilet bowl.
Do not defecate in the toilet and get the sample from there. It has to come into the hat, okay?
Instruct the patient to add stool to the collection vial or vials. If the stool is solid, he should use the scoop on the lid of the container to add a large jelly bean-sized piece of stool to the liquid in the vial.
And once you do that, you will have this container, and then I will also give you a spoon, or you can get your own spoon, to be able to get the sample out of the hat to place into.
If the stool is liquid, pour it into the container. In both cases, keep adding the specimen until the liquid preservative in the vial reaches the indicated level.
You will also have these two other samples that you will have to collect. It's a red fill line on this one, and it's a black fill line on this one. The fluid that's inside of the samples, you need to make sure that you put enough stool in it for the fluid to fill up to the fill line.
Okay.
There is a spoon on the bottom of the cap.
Instruct the patient to tighten the caps completely and wipe the outside of the vials with alcohol wipes or to wash carefully with soap and
I
water.
will also put a few alcohol wipes in there for you to wipe the outside of the containers.
The vials should be labeled, placed in a biohazard bag with a zippered closure, and transported to the laboratory immediately if possible.
When you are done collecting the samples, you need to make sure that you are putting your name, date of birth, all your information, and also the date and the time that the sample occurred.
Okay.
You're going to put that on each one of the samples.
All right.
After that, you're going to place all of them inside a biohazard bag so you don't have to worry about just having them laying around. And then you'll bring it back to the lab.
Do I have to keep it in the fridge?
No, you do not.
The vials should not be refrigerated. Instruct the patient to wash his hands after the specimen collection process.
And also make sure that you wash your hands when you're done. Okay?
Document the instructions given to the patient in his health record.